Good morning, everybody. Welcome to Dr. Tom's Tips on Tuesdays at 10 in 10, September 15th. This is awesome. So the purpose of this is to hear tips from Dr. Hirsch about how to use Isolite in a whole bunch of different scenarios. Today's topic is about how Isolite can help dramatically in minimizing transmission of diseases. So when you look at the system and how it's connected, Dr. Hirsch, what are some tips that you can give our viewers, our listeners, folks here on how Isolite can help in eliminating or minimizing disease transmission?
Okay, let's talk about that one. I'm going to specifically dial into COVID today because it's going to be with us. So that's what we're going to talk about. And whenever we start working on projects, boy, you get surprises. I got a great surprise this morning when I was getting ready to do this little piece. First thing that happened to me, my computer decided to reboot itself and update everything. So now I waited for 15 minutes while this thing is happening and trying to get ready for the presentation. And then I wanted to get my stuff, and I had to go in my hygiene room and get one of my Isolite i2 heads off. So I go to take this thing off, and man, it doesn't come off. It's connected to the hose. And I'm pulling on this thing, and the thing's not coming. It's not coming off. Okay, so what else is going to go wrong today? But I happen to know the solution if this is stuck to your hose. Take this. Take the light pipe out. Take this, attach to the hose, dip it in some hot water. I know that's not the topic of conversation, and it separates really easily. So that's what I did this morning, getting ready to get this whole thing done. So that being said, let's get into the subject. So what happens? The patient comes into your office. They're sitting in the chair. They take their mask off. What next? What do we do next? Well, the next thing that we do is I have the patient rinse twice. We've got to start killing some bugs. So it's going to rinse twice with the Colgate Peroxol right now. 2 rinses, 30 seconds each. They spit it, they rinse, they spit it out, they rinse again. It really starts to minimize the bacteria. So that's the first thing that we do to start minimizing bacteria and for disease control. The next thing that we do is actually the most important thing that we can do to minimize airborne aerosol and to reduce the bacteria output in the airborne aerosol. And this little thing that I have in my hand right here, we all know what it is. It's your saliva ejector. When you are working,
saliva ejector or HVE?
Thank you. HVE, boy, I'm looking at it and it's still, no, it's an HVE. Thanks. So appreciate that. Okay. So the HVE, so when you're working with this thing, take the HVE and get it as close to you as you possibly can to the tooth that you're working on. Your high-speed handpiece is going to emit a lot of water, a lot of air. It's going to go into the atmosphere. This will capture a whole lot of stuff, probably better than anything else that you've got in your office. But we want to make sure that we capture as much as we can. So I have my assistant hold this as close to the tooth as you can possibly get it. All right, next to where we're working. Okay, usually it's on the buccal side because I have a secret. On the lingual side and also on the buccal side, I've got my Isolite mouthpiece. So what happens is with a combination of these two products, the Isolite and your HVE, you will minimize a lot of the airborne aerosol, and that will get it really reduced. Okay, so that's when we're drilling. And even before we start that drilling, another thing that you can do, and I have to give accolades to Gordon Christensen on this because I learned this from him. This is not my idea. This is actually his recommendation. Scrub your tooth with some Paradex, wherever it is, right there. And also scrub it with some ethyl alcohol. Not my idea, Gordon Christensen's idea. So Gordon, thank you. I'm stealing your idea. I have to give credit where credit is due. So scrub the tooth with those two things. That's the next thing that you can do. And then when you're done with your procedure, you want to sit down there with it. When the Isolite is in the mouth, before you take it out of the mouth, you want to spray down the mouth. You want to rinse it all down. And just get all the airborne, just get all the particles and debris out so it's not going out and getting transferred outside of your operatory. Another device, and I forgot to mention this, another device that works quite nicely is the rubber dam. So for those of you that are utilizing the rubber dam, put that thing on. It does it's a great barrier for keeping a lot of the bacteria from within the oral cavity coming out of the oral cavity. So utilize that. A lot of people don't like to put the rubber dam on. Use the Isolite. It works fabulously for that.
The tip is in conjunction with an HVE, in conjunction with the rinses, in conjunction with Paradex and all that type of stuff. Isolite, very helpful because it's connected to the HVE and it's evacuating.
Exactly right. I appreciate you summing that up so nicely. So what we actually have going in the mouth at any given time is we actually have 2 HVEs going at any given time. The one traditional HVE, and then the Isolite, which is also connected to the HVE. So you've got double HVEs going on. And there's your tip. You summed it up better than I did, but now we've got 2 HVEs in the mouth. 2 is usually better than 1 most of the time.
Cool.
And then, okay, so that's that part of it. And then, as I said, when you're done with your procedure, you can go ahead and just spray and clear up the debris. You can leave the Isolite on to vacuum everything, but it's important because now you're not working in the mouth. You've got the Isolite sucking everything out. It will really desiccate the patient's mouth out. So it will make things really dry. So we want you to be aware that when you're putting the Isolite in, that maybe you don't leave this on high volume at any point in time when you're not working.
Don't leave it in. So you can turn it down.
Turn the air down, yeah.
Leave it in. So you're saying second tip is leave it in the mouth when you're done because it's constantly and it's hands-free. So it doesn't tie you up.
Totally hands-free. You know, your system doesn't have to be there evacuating anymore. It's pulling, it's a negative vacuum pulling everything in out of the air. So it really works quite nicely. Another thing that we need to do, and it's kind of a precursor to everything, and I probably should have talked about this first of all, is check your vacuum system. Make sure that your vacuum system is operating properly in all of your operatories. Way that you can do this is take a 16-ounce bottle of water, take your HVE tip, put your HVE tip in there, time it. It should clear out this 16-ounce bottle of water in about 6 or 7 seconds. If it's not clearing that out that fast, then you've got a problem and you need to go back and either look at the adjustments at your main vacuum system at the unit that's actually doing it. I'm sure there's adjustments there. You're going to have to talk to your service tech there because I don't know what those adjustments are. In my operatory, we have one operatory that doesn't really have the suction or the air pressure that the other ones do. So each operatory is going to be a little bit different. Make sure that you check each one of your operatories to make sure that they're vacuuming appropriately. And then the last thing that I'm going to cover right here is at least once a week, take your Isolite apart. There's little levers right here. The levers come off. It's very easy to take the levers off. All you have to do is this little lever, when this is disconnected, just take the lever and push it upwards or downward, depending on your orientation. And you'll see this actually comes off over the end of the Isolite. It's like a bumper. So I'm pushing this with my thumb, and it kind of pops out just like that. Did you see that well enough? That show?
Yep.
Okay, so here we go. Both sides, left side, right side. Take your thumb, hold on to the Isolite, and just give it
a little higher.
There, right there. And
Yep.
if you push, you're going to watch this thing kind of pop out. Hang on, just kind of pops out, and it's in my hand right there. Did that go pretty good?
Yep.
Okay, good. So that's another thing. Make sure that you look at these little holes right here. Holes right. There they go.
There you go.
Yeah. So make sure you clean those things out. Make sure you look inside that there's no debris captured. So those are the tips of the day. Make sure your system is clean. Make sure the mouth is clean. Use the appropriate medicaments to clean the bacteria out, and use that Isolite to help reduce that airborne aerosol.
Awesome. You know, we're not saying that Isolite eliminates COVID. So want to be clear about that. What we're saying is, in conjunction with the other things you already have in your practice, because Isolite is connected to the HVE, because it's hands-free, it's a phenomenal way to keep maintaining the evacuation so you minimize the expression of aerosols in the practice. Exactly. I like the idea of reminding people about all the cleaning before. So Thank you, sir. Anything else?
That's all I got today.
Awesome.
And
Well,
now
hey,
you know
folks.
what I'm going to do? I'm going to go back to work. I got to put some implants in.
Cool. Well, thank you, Dr. Hirsch. Thank you so much. It's always a pleasure when you're here because I don't know what it is. You've got more energy than I do, and I'm definitely. Well, it's because you're only what? Okay, we won't get there. So those
Yeah.
of you,
You know what? I'm the old dude. My dad just passed away. He was 99 years old. This guy had
wow.
more energy than the ever ready bunny. My God, he never stopped. So hopefully I got a little bit of that from him.
There you go. So, hey, folks, if you like this, please share. If you have any other questions, please ask us. Send them to us. Thank you for joining us for Dr. Tom's Tips on Tuesdays at 10. Send us your questions. Send us things you want Dr. Hirsch to cover. Thank you so much, sir. Have a great week. Please be safe, and I'm sure we'll talk soon. Well, we're definitely going to talk soon. See you next
Thank
Tuesday.
you, everybody. Thanks for listening. Thanks for tuning in. Send me some ideas. I've got lots of ideas in my head, but you may have some things that I don't even think about. So send them in. Let me know what you want to hear. Rolando, thank you very much. Everybody be safe. Practice safe.